If you tend to suffer from painful or swollen joints, a loss of flexibility, or you feel a grating sensation when you move, it could be that you're suffering from osteoarthritis. But don't worry, help is at hand. According to the World Health Organization, around 528 million people are living with the condition worldwide, including more than 32.5 million Americans. In this video, we'll discuss the symptoms of osteoarthritis, plus 7 risk factors you really ought to know so that you can manage the condition and improve your quality of life. Let's learn more about it so that you can put your mind and joints at ease. Osteoarthritis is often described as a wear and tear disease. It develops when the protective cartilage that cushions the end of bones in your joints gradually breaks down. Cartilage is a tough, smooth tissue that allows for smooth and nearly frictionless movement within the joints. In addition to cartilage breakdown, osteoarthritis can affect the entire joint. It can lead to changes in the bone structure and the deterioration of the connective tissues, which are responsible for joint stability and muscle attachment. Inflammation of the joint lining also occurs. Eventually, if the cartilage wears down completely, bones will begin to rub against each other, which can be quite painful. Other symptoms include stiffness, swelling, tenderness, a loss of flexibility, and a grating sensation. While osteoarthritis can impact any joint in the body, the knee is the most commonly affected joint, followed by the hip, hand, and spine. Unfortunately, joint damage cannot be reversed. However, certain measures can be taken to slow the progression of arthritis and alleviate pain while improving joint function. More on that later. But first, let's take a look at the 7 most common risk factors, which are as follows. Number 1. Age. Osteoarthritis is more common in older adults. About 73% of people living with osteoarthritis are older than 55. This is because as people age, the cartilage in their joints wears down more easily. That doesn't mean it happens to everyone though. Number 2. Obesity. Excess weight puts additional stress on weight-bearing joints such as the knees and hips. This can accelerate the breakdown of cartilage and increase the risk of osteoarthritis. Number 3. Joint injury or overuse. Previous joint injuries, such as fractures or ligament tears, can also increase the risk of osteoarthritis. Equally, repetitive movements or the overuse of certain joints can contribute to cartilage wear and tear. With aging populations and increasing rates of obesity and injury, the World Health Organization expects the number of osteoarthritis sufferers to continue to increase. Number 4. Genetics. There is evidence to suggest that genetics play a role in the development of osteoarthritis. People with a family history of the condition may be more likely to develop it themselves. Number 5. Gender. Osteoarthritis tends to affect women more frequently than men, particularly after going through the menopause. 60% of sufferers are female, and hormonal changes may contribute to this increased risk. Sorry, ladies. Number 6. Joint deformities. Certain joint deformities, such as those that exist at birth or develop later in life, can increase the likelihood of the disease. Number 7. Pre-existing medical conditions. Certain medical conditions, such as rheumatoid arthritis, which is caused by the body's immune system, as well as conditions like gout and other metabolic disorders, can also increase the risk of osteoarthritis. These conditions may either directly affect joint health or predispose individuals to joint damage. Unfortunately, it's not possible to prevent osteoarthritis altogether or to reverse the damage to your joints. However, you may be able to minimize your risk by avoiding injury, not overusing your joints, and living a healthy lifestyle. There are also steps you can take to manage the symptoms. First, talk to your doctor. They'll be able to recommend a treatment plan and advise you on how best to deal with the condition, especially if you suffer from other medical issues as well. Second, stay as physically active as you can. Some people worry that doing exercise will make their condition worse, when in actual fact, as long as you're not putting too much strain on your joints, certain activities can reduce pain while improving your mood and flexibility. Experts recommend at least 150 minutes of low-impact exercise per week, such as walking, swimming, or cycling. Third, if you're overweight, losing weight will reduce the pressure on your joints, particularly the hips and knees, slowing the progression of osteoarthritis. And finally, protect your joints. As you go about your daily activities, including exercise, be mindful of how much stress you're putting on your joints. There are also products you can buy, like joint sleeves, that can help to alleviate pressure and pain. Now that you know the risks of osteoarthritis and how to deal with them, all that's left is to like this video and subscribe for more helpful tips in future. See you again soon, and thanks for watching.